The year was 2016. I had just left the Marine Corps after 5 years as an infantry rifleman. I was ready to transition into the civilian world and had my whole life ahead of me. I was very excited. But the transition was not easy. Slowly after time, I realized that depression was growing. I was having nonstop anxiety and a lot of anger issues and other emotional problems that I had no idea how to control and no idea where they were coming from. I was very afraid, and finally I went to see a doctor who referred me to a psychiatrist who diagnosed me with PTSD. When I was diagnosed, I felt like I had a problem and I didn't know what to do or where to go. But I began therapy, and after many years of very hard work, I have been an advocate for veterans, homeless, and many other groups for PTSD, and I've even worked alongside state senators and congressmen to help with the communities and their PTSD programs. Today, I'm going to be discussing what PTSD is, the signs, the symptoms, the causes, as well as how to help yourself and others around you, what the treatment options are, and how to build a support network. So first, what is PTSD? PTSD is post-traumatic stress disorder, and it comes from a traumatic event, whether that be life-threatening or something that was so terrifying it stayed in your brain as a response to anything that may somewhat resemble an event like that happening again. But it all comes from a trauma. Not everyone who experiences a trauma will develop post-traumatic stress disorder. The general population, approximately 1 in 10 individuals will experience symptoms of PTSD following a traumatic experience. Sadly, though, in the military, approximately 60% of individuals experiencing a trauma will have signs of PTSD. Some of the symptoms can include re-experiencing things, such as flashbacks, intrusive thoughts, unwanted memories, physical and psychological, or even hyperarousal, such as sleeping difficulty, irritability, hypervigilance, increased startle response. There are other symptoms such as avoidance symptoms, like thoughts and feelings about traumas that you don't want to think about. Avoiding trauma-related people, places, or things. And then also the use of drugs and alcohol to forget those traumas. And also negative alterations in mood, feeling numb, feeling guilt, shame, being very sensitive, no self-esteem. It's very, very bad. How to help yourself and the people around you, though? It's definitely important to talk to anybody if you're feeling any signs of PTSD. And it could be in the form of depression or anxiety. Sometimes it's just best to see a medical professional, and that is the first thing you should do, if not talk to a friend or family. So that brings me to building a support network. You should have at least 10 people in your support network that you can call at any time. Phone numbers, addresses, everything, just in case there's any kind of a medical emergency regarding your mental health. And there's many, many treatment options. Some of the treatment options include therapy, of course. Cognitive behavioral therapy is one of the most effective and the one I used the most. And daily management and healthy living options include eating healthy, sleeping well, getting exercise, going outside, doing everything that a normal person should do to stay healthy. So when it comes to finding signs in others and knowing when to reach out, I think that as soon as you see any sign of those re-experiencing certain thoughts or behaviors, or the hyper arousal or the avoidance or those negative alterations in mood, if any of those are present in any of your friends, family, acquaintances, anything like that, you should notify someone immediately, and there's many resources to do so, because they may be using a technique called masking, which is hiding your emotions, and a lot of people can be very good at that, and you should be able to try to do your best to see if you can help them. Anyways, to summarize, PTSD is post-traumatic stress disorder. It comes from many different places and for many different reasons, and affects people in many different ways. And it has many symptoms that can make life very difficult for most. I have to emphasize the importance of helping others when you see signs of PTSD, and how it can save lives. Just being there for someone, just to talk, or just by getting them the right help they need in the right amount of time. So I hope this information sees you well, and that you will have the confidence to at least know some of the signs and symptoms and being able to recognize those signs and symptoms in people you know, and to support your community who may be suffering from PTSD. Thank you.